Hi, my name is Evan. I'll be your nurse today. Can you state your name and age for me?
Jaden, 23.
All right, Miss Jaden. So today you are here for a cardiac and peripheral vascular assessment. I will be doing a lot of, excuse me, touching and listening to a lot of different places. We'll also be locating and identifying your pulse areas and your heart valves. Okay. So at any time during this assessment, if you have any discomfort, please let me know. Sanitize my hands. Made a little mess. Sorry. So we're going to start with your upper extremities. Can you stick your arms out for me? All right. Your skin is nice, warm, and dry. The symmetry of your arms are symmetrical, which is great. Your hair distribution is nice and even. Your skin turgor bounces back really nicely. Your capillary refills are less than 3 seconds, which is perfect. Can you squeeze my hands for me? All right, great. Your hand grip is nice and strong. Okay, so now we're going to locate your pulses. These are your radial pulses and your brachial pulses. All right, you can relax your arms. Now we're going to move up to your neck and we're going to look at your carotid arteries. So we are looking for any lumps, bumps, bruises, or pulsations, and none are noted. So I'm going to check them one at a time. Okay, can you turn your head to the left? Perfect. Can you turn your head the other way for me? Perfect. So I'm going to use the bell of my stethoscope and I'm going to give it a listen, okay? So I'm going to instruct you to take a deep breath, to breathe, to hold, to breathe, to let it go, and then to hold, okay? Take a deep breath, blow it out, and hold. All right, breathe normally. Okay, same thing on this side. Take a deep breath, release it, hold it. All right, you can breathe normally. Perfect. So now we are going to locate your heart valves. This is your second intercostal right side, which is your aortic. We're going to come across. This is your second intercostal left side, which is your pulmonic. We're going to come down to the third intercostal, which is your earth point. We're going to come down to the fourth intercostal left sternal border, which is your tricuspid. Then we're going to come over to the mid-clavicular fifth intercostal, which is your mitral, also known as your apical pulse. And those same those same landmarks, I'm going to listen to them with my diaphragm. Okay, this is your second intercostal right side, aortic, across. This is second intercostal left side, pulmonic. Third intercostal herbs point. Fourth intercostal left sternal border is your tricuspid, and your mid-clavicular fifth intercostal, which is your mitral, also known as your apical. Okay, great. So now I'm going to have you, now I'm going to have you lay back. And we are going to be checking for your jugular vein distension. So can you look towards me? Okay, none noted. Can you look the opposite way? Great, none noted. You can look straight. So now those same landmarks, we are going to check those same landmarks for your pericardium pulsation, which is your pericardium is the sac around your heart. Make sure there is no lumps, bumps, bruises, pulsations. So this is your second intercostal right side is your aortic. I'm going to come across to the second intercostal left side, which is your pulmonic. Come down to the third intercostal left sternal border herbs point. Gonna come down to your fourth intercostal left sternal border tricuspid. We're gonna come down to the mid-clavicular fifth intercostal space, which is the mitral, also known as your apical pulse. All right, and now I'm going to use the diaphragm of my stethoscope to listen. Aortic, pulmonic, herbs point, tricuspid, mitral, also known as your apical. Now I'm going to use the bell of my stethoscope. Aortic, pulmonic, herbs, tricuspid, mitral, also known as the apical pulse. Now I'm going to come around. Come around a little way. All right, can you turn to the left side for me? This is, I'm going to be listening to your left lateral mid-clavicular fifth intercostal space. And this is your mitral, also known as your apical pulse. All right, everything sounds great. You lay back on your back for me. So now I'm going to come down to your lower extremities, and I'm going to check the symmetry of your legs, which they are nice and symmetrical. Your skin is warm and dry to the touch. No varicose veins noted. No edema noted. Your hair distribution is nice and even. And now I'm going to check your groin area. This is your femoral pulse. I'm going to check behind your knees. This is your popliteal pulse. I'm going to check the inner ankle, which is your posterior tibia. The top of your foot is your dorsal pedis. All right, now we're going to go ahead and sit up. All right, and that concludes our assessment. Any questions? All right, thank you. I'm giving a report on a 23-year-old female. She came in for a cardiac and peripheral assessment. We started with her upper extremities. Her skin was warm and dry. Arms were symmetrical. Her hair distribution was even. Skin turgor. Her skin bounced back real nice. Her cap refills were less than 3 seconds. Her hand grips were nice and strong. Her radial and brachial pulses were even bilaterally. Then we went on to her neck and we palpated her carotid on both sides, one at a time. We also auscultated with the bell of my stethoscope. No lumps, bumps, bruises, or pulsations were noted. No thrills or murmurs were heard. I listened to her chest while she was sitting down with the diaphragm and the bell of my stethoscope. No murmurs or thrills were heard. I educated my patient on the locations of each pulse site and the valves of her heart. I listened to all heart valves. No murmurs or thrills were heard. I assessed her jugular vein. For jugular vein distension none noted. I checked her pericardium. I inspected that for lumps, bumps, bruises, or pulsations. None were noted. I palpated all areas of her heart valves. There were no tenderness, no pulsations. I also listened to her apical pulse at the fifth intercostal space at the midclavicular line, and also her left lateral midclavicular at the mitral valve of the fifth intercostal space. Okay, then I moved down to her lower extremities. Her legs were symmetrical bilaterally. Her skin was nice, dry, warm. Hair distribution was nice and even. No signs of edema, varicose veins. Her skin was warm and dry. Her hair distribution was even. No varicose veins, no edema. I feel like I'm missing something else. Skin, hair, skin temp, hair. Color was appropriate. Oh, I don't remember. All pulse sites were palpated and they were equal bilaterally. I did educate my patient. That's the end of my report.